Incontinence affects over 500,000 of us, but we don't often talk about it. Dr. Cathy Stephenson's continuing her discussion with advice today on how to treat the pelvic dysfunction that often follows childbirth. Welcome to the show. Lovely to have you here.
Thanks, Brendan.
I guess the first thing I want to know is determining what type of incontinence you have, isn't it?
Yeah, and it's important to do that because the doctor will then be able to decide what sort of treatment's going to suit you best as well.
Right.
So make an appointment with your GP, and they're just going to start by asking you a whole load of questions. You know, when do you get leakage? What sort of triggers it? How often is it happening? You know, did it start with childbirth? Has it come on after that? And once they've worked out what might be going on, they'll do some really basic tests. They'll want to examine your tummy. They may want to do a genital or rectal examination. They'll send off a urine to make sure you haven't got a urine infection, and quite often do some bloods just looking for diabetes and kidney impairment as well. But it's all pretty straightforward stuff, and for most people that's enough to decide what's going on. Occasionally you'll need to go and see a specialist, but that's certainly the exception rather than the rule.
I imagine there are some people out there that can become quite fearful, not knowing what to expect when they go in for their examination.
Absolutely.
And I guess by knowing that, it prepares them and it makes it a lot easier. Let's go through let's talk about the main treatments. The first one, behavioural change.
Yeah, and I mean, there are 4 kinds of areas we look at when we're treating incontinence, and a lot of people will need a combination, but the simplest one to start with is behavioural change, and weight loss is key. Anyone that's carrying excess weight, that's going to put more strain on those weakened pelvic floor muscles and make any incontinence worse. So try and get your weight down if you can. Look at what you're drinking. You know, both alcohol and coffee are stimulants to the bladder and will cause irritation. So reduce those where you can, and make sure you're drinking plenty of fluids. So at least 6 to 8 glasses of water a day to keep your bladder and your kidney system well hydrated. Look at your bowel motions. Any constipation at all will make any incontinence worse. So soft, regular bowel motions, lots of fruit, lots of fluid again. And then probably the most important thing with behavioural change is something called bladder training or bladder drill. And the concept behind this is that if you're somebody that tends to go to the toilet just in case, so you go before you leave the house, or you go before you go to work, or you go before you go into a meeting.
You want to hold on.
Yeah, your bladder gets used to the fact that it can only hold a little bit of urine and then you need to go. And that's called urge incontinence. And you can actually retrain that by making yourself wait. So you can say, right, I'm going to hold off for a couple of minutes, and then your bladder will gradually get used to having a bigger capacity. There's actually good information about that on the incontinence website as well, so it's worth looking up. If your problem's primarily urge incontinence, have a look at that. Your
next one, pelvic floor muscle training, which is an important one. We were chatting about it before. Pre-pregnancy is a good time to be able to strengthen that pelvic floor area up, so that when after you've had baby, it's not as hard to get that strength back.
I mean, you can never start too early with pelvic floors, and the first thing is to just locate the muscles and make sure you're doing it correctly. So sit or stand and squeeze and lift as though you're trying to stop yourself passing urine, and if you can feel that things are lifting up, then that's the right place that you're working on. And you want to start with some basic kind of 4 to 5 second holds of those muscles, and do that a couple of times, and then do 10 quick squeezes and repeat that whole cycle twice. And aim to do that when you're starting out about 3 or 4 times a day, and then as you get better at it and your strength improves, you know, you go for longer and you do more repetitions, just like any kind of exercise workout, really.
And it's not much of a movement that you have to do, you know, to be able to target that area. Everyone thinks, oh, you've got to be doing that full, you know, maybe sit up or whatever, but it's actually just a slight motion, isn't it?
It's a very specific group of muscles. You've got to breathe when you're doing it. It takes about 6 months to get, you know, really, really good improvement, but up to 80% of people are going to get cure with that exercise regime. So it's a really important one to do. There's a really good website called PhillyFit, and there's another one, again, the Incontinence website has got loads and loads of sheets you can download about how to do these exercises.
All right, next one, medication.
Medication. Thankfully, not many people will need medication. There's 2 or 3 groups of medicines, and they primarily work by relaxing the smooth muscle in the walls of the bladder, so they reduce that sort of desire of the bladder to go all the time. So they can work quite well, but most people will not need medication.
If they do take the medication, are there many side effects?
Yeah, there can be. People can get dry mouth and that kind of problem. So again, you'd need to talk to your doctor quite carefully about the benefits versus the side effects of those various drugs. But most people will be managed with the behavioural change and the pelvic floor regime and won't need medicines.
And the final one, surgery.
Surgery. Now, if the pelvic floor regime isn't working and the behavioural change hasn't worked, your doctor might talk about referring you to a specialist. And there's different kinds of surgery. Most of them involve, you know, somehow sort of lifting the bladder and the pelvic organs up and stitching them up so that they're not sort of putting extra strain on that pelvic floor area.
Right.
And that's done by a gynecologist.
Right.
It's commonly done and they're relatively risk-free, but that would certainly be the last in the line of treatment options for most people.
Well, here's one for men. Do men get incontinence?
Absolutely.
Really?
I think it's a myth that this is just a problem in women, especially as men get older, but certainly men with diabetes, men who have had strokes or have Parkinson's disease, and often after prostate surgery too. It's a big problem for men.
So we can probably do the same things. We can do pelvic floor exercises as well to strengthen that area?
Exactly the same pelvic floor exercises.
Right.
And it helps stop leakage, but it also helps sexual function. So, you know, lots of benefits for men.
And also that diet, the coffee, the alcohol, the same thing, everything
the same treatment for men.
There you go. Hey, Dr. Cathy, great talking to you today. Thank you so much. Some great information.
Thanks for having me on, Brendan.
Wonderful. And check out our website for the chance to win copies of The Core and The Floor, a DVD of complete post-pregnancy program.